Hello, everyone, and welcome to our weekly Living Well series. I'm Tara Parker Pope, founding editor of Well, the Times Consumer Health section. Today, I'm so pleased to be joined by Dr. Shan Soe-Lin, a global health specialist. She's also the managing director at Pharaoh's Global Health Advisors, a nonprofit advisory firm in Boston. Shan, welcome.
Thanks for having me.
Well, I'm so glad you're here. We have a couple quick things to talk about. Dr. Soe-Lin has been advising several communities on how to safely reopen, and we're going to ask her advice about how to stay safe in these times. And we also want to hear from you, our listeners. So quick housekeeping note before we begin, you may submit questions at any time during the event using the Q&A feature in Zoom. Tell us where you're writing from, and please note that this event is being recorded. So let's get started. Welcome to everybody. Send us your questions. So Shan, the reason I really thought you'd be the perfect person for this is that several weeks ago when the CDC and the global health authorities were telling us not to wear masks, that masks should only be saved for healthcare workers, which the medical mask should still be saved for healthcare workers. You co-authored an op-ed. It was in the Boston Globe, but that's okay. Telling the world that we should be wearing masks, and this was bad advice that we were getting. So tell me a little bit more about that. Why did you decide to come forward, and what made you so sure that we were not being given good advice?
Well, thanks for that question. And this really, I had no idea what a little op-ed would do actually in the last 2 months. It really started from just some research I had anecdotally heard about from the SARS epidemic, which is a related coronavirus that caused a lot of problems about 20 years ago. And I'd read that masks had been found to be actually extremely protective in that time, and I remembered that. And I was thinking, why are we being so reluctant to use something that's so cheap and so universally accessible? And the more digging I did, the more evidence I found. And it was just very aggravating as a scientist to hear experts saying things that just were actually factually not correct, I guess, just to be blunt. And to do that, I guess for noble reasons, in the sense that, again, there is this acute shortage of medical grade masks, but leaving out or not trusting that the public could tell the difference between a cloth face covering and a medical mask, and really not giving people the right information that would protect them. So that's where that germinated from.
See, and I think that what we've learned since then, people thought, oh, well, a cloth mask is not going to be very protective, but a lot of smart scientists have been testing these masks. They've been doing all kinds of different ways of studying it, and we're finding that masks are very protective, right? Even a homemade cloth mask is really doing a lot of good.
Exactly, and in both directions. I feel like the CDC did their pivot in a way that was somewhat face-saving to say, oh, we didn't know about this asymptomatic issue, so it's actually to protect others from you, which is true. But I still wanted to stress that there's still some protection even just for yourself as well. That masks can also help you prevent you from touching your own face. They do provide some barrier protection from big droplets, sneezes, and coughs. Masks work for you, and they also help other people around you. So it's really one of the most powerful things I think we could be doing right now in solidarity and to be protecting each other.
And I think that as we start talking about what the new normal looks like and how we're going to move forward, when the pandemic is here, the virus is here, I feel like masks will set you free. Like if you wear a mask, if your group wears a mask, you have more opportunity. Embrace mask. And if the more people who wear masks, the more protection we all have, right? They don't work if only a couple of us are doing it.
No, and that's the hard part where people say, oh, we're in this together. No, we are literally in this together. So I think there's been some good modeling that was recently done out of Berkeley that showed that masks really only work if 80% of us are using them. At least more is better, but I think 80% is the kind of threshold. So if 75% of us are wearing it, then we probably shouldn't. It's not working as effectively as it could be, and that's humbling.
Even in your group, I was talking to somebody the other day where a grandmother was visiting with family and she wore a mask. And I said, well, actually, the wrong person was wearing the mask. Everybody should have been wearing the mask. But if somebody was going to not have a mask, you want everybody else, the grandmother's the vulnerable person. So if you're with the vulnerable person, you need to have a mask on. right?
Yes, exactly. And I think, again, it's not even common sense. There's some good data around that. Partners Healthcare here in Boston, which is one of the biggest health systems, was one of the first health systems to adopt universal masking for everyone who's coming into their property. And they found that there's this massive reduction in infections for their health workers. I think it was over 50%. It might have even been 70 or 80. I don't totally remember. And they basically ended all hospital transmission, which is huge when you think about this hospital that was really the ground zero in Boston for COVID infections. And the few infections that were still happening in their health staff were actually happening in the community. So it happened when health workers went home.
Interesting.
So I think that's, again, it's anecdotal, it's not published, but this is powerful evidence that if everybody wears masks, you could probably stop this thing, or at least push it way down while we're waiting for a vaccine.
And we also know that the countries that are doing very well, or some of the countries that are doing very well, mask wearing is common. Is that correct?
Exactly. So again, that was one of the big pieces of evidence at the beginning before we had this excellent recent data that was coming out. Hong Kong, Taiwan, Japan, China, countries that already had endogenous high mask wearing culture, I guess. They were doing this before. Some of them, even Hong Kong and Taiwan, remembered how scary the first SARS epidemic was. So actually they were able to boot up much faster, but it's still part of their culture that if you were not feeling well, it was rude not to put on a mask. And I think I read a quote somewhere that I thought was great from somewhere in Hong Kong who said, you know, not wearing a mask here is like not wearing pants. So that's how ubiquitous it is there. And it would be great to see it treated with the same level of adoption here.
I think people here don't really realize how scary SARS was. You know, that had, tell me if I'm wrong, but like a 30% fatality rate. It was wasn't it very high, maybe 25? It's a high fatality rate.
I think it was 10 at the end of it, but in the fulminant part of it, like where we kind of are now, where we're not sure if it's 5 or 0.1, it was thought to be as high as 30. MERS, which is another, I think, even more terrifying virus, except it comes from camels. So if you just stay away from camels, actually, you're pretty good on MERS. That one has a 30% infection rate. But SARS was pretty darn scary. Like if you can picture how scary COVID is, SARS is 10 times scarier than COVID.
Right. And so those communities were really highly motivated to wear a mask. And once they start doing it, it's not that terrible. If you just say, this is life, I'm going to wear it, I'm going to get used to it, you do, right?
I mean, I was I think, one of the earliest adopters of masks, been wearing it since February. And when people say, oh, I'm really uncomfortable, or I just hate it, I would suggest that you also do some investigation and investment into a mask that you can wear comfortably. This is just something that I've discovered. I have like 15 different kinds of masks that I've purchased from different places, and I have different preferences from my husband. He likes the ones with pleats. I like the ones that sort of fold in half. I think it really depends on your face shape, finding the right kind that doesn't pull on your ears too much. So this is something that you're going to have to be wearing probably for the next year at least. So if you don't like it, try to find something else. Find something that you can live with.
I think this is super good advice, and I hope everybody listening embraces it, because, you know, I went on Etsy, I found different companies making masks, and you know, some of them came and they were just these tiny little things that barely covered my face. So I gave those to like a toddler. And then, you know, some of them were just too loose and the loops were too tight. And, you know, it's the Goldilocks, you know, you've got to find one that's just right. And what's just right for my face is not going to be just right for your face. So that is, if you hate your mask, maybe spend some time trying to find one that you can live with. I think we should start taking some questions. I think it looks like we're going to talk a little bit about spending time with people. So this viewer from Brooklyn asks, my 34-year-old daughter in Brooklyn had COVID in April. So she had it. I don't know if she had a diagnosed test. That might change your answer. If her antibody test comes back positive, can she come visit us in Vermont? We are 67 and 70. Should she quarantine? So there's a couple unknowns there, but let's say she has a diagnosed, confirmed COVID test, and it's many weeks since she's been ill. What would you advise about visiting older parents, and should she still quarantine? What would you say?
Well, I guess I'll give two answers. One is the gold standard answer, and one is maybe good enough answer. So the gold standard answer would be, if she could, would be to get a follow-up COVID test to make sure that she doesn't have any active virus right now. The 14-day quarantine, or there's varying guidance now about if it's 5 days after your symptoms end, 2 weeks. But there's certainly a lot of evidence that shows that people can still at least shed virus many weeks actually after they have allegedly recovered. And it's not known whether those viral particles that are still coming off are infectious, but if it's your parents and you love them, I think you would want to take the most precaution. So I would say for antibody test is positive, and again, we don't really know what that means, to be blunt. We know you've made antibodies. We know you've recovered, at least recovered enough to have an immune response, but we don't know if that is going to convey immunity. I would guess that it does, but that hasn't been confirmed. If I were her and the daughter and I was feeling better and it had been 6 or 8 weeks after, if you could get an extra COVID test just to make sure you were in the clear, that would be the best thing. If not, I would still probably wear a mask when I go see my parents. I would try to meet outdoors. I would still try to take precautions.
Interesting. At some point, though, sorry?
Oh, I was just going to say, I mean, in some ways, you can't be too safe.
Right. So it would be good if she could get a negative test. That might give her a little more freedom. Mm-hmm. If it's been several weeks since the illness was in April, if we're talking, 8 weeks, 12 weeks? I don't know. I guess the more time that passes, the better. So I guess you'll have to make that decision as a family, but a mask might be a good idea if you're in closed spaces, especially.
I think so. And April is a little unclear. Was it end of April, which means it's only 3 weeks?
Yeah, we don't have quite enough information, but yes. But hopefully that viewer can get some guidance from that. Another viewer asked, if a grandparent quarantines for 2 weeks and the grandchildren and their family are in quarantine, is there any reason for them to not reunite and spend time together? Now, this is the biggest question. Grandparents are desperate to see their grandkids, and we want grandparents to not be lonely and to see their families. So can you do this safely? If you've got partly it depends on how you define what a quarantine is, right? So you've got 2 groups of people quarantining separately. When can they safely come together and not wear masks and just be normal?
Mm-hmm. Well, again, I can tell you the gold standard answer and the good enough answer. So I don't know if you've had the same experience, Tara, but what I would consider quarantine and what other people consider quarantine are sometimes variable. So if you have my level of quarantine, which is if I ever have to get contact traced today, I can say the only person I've spent any amount of time with in the last 2 months is my husband. I have not been in the presence of anybody else except my brother-in-law one time for a walk, and we all wore masks. So that was several weeks ago. If that's the level of quarantine that both sides can maintain, then I do think it's safe to do at least what in Canada they're calling bubbling. Like you can have a bubble partner where you find another family or another, in this case, a set of grandparents who have the same strict risk management protocols that you do, and you can safely interact with each other. That would be okay. But again, if you are a family and you have some leakage in your quarantine protocol, you have to go to the grocery store, for instance, delivery people came over, other people entered your house. Anytime that you have a break in that protective bubble, again, I would be extremely cautious. If your parents are older, I would again still wear masks. I don't think that that's a huge imposition to do. I would have outdoor activities, but certainly I understand, and everyone's understanding now that we can't do this for a year where you can't see anybody else.
Yeah, I think the question here is, are these grandparents and these grandkids and is this family gonna stay together? Mm-hmm. Is this just for a brief visit? If this is for a brief visit, just wear a mask. If this is for a long period together, then everybody needs to be on the same page. Because what you just said is so true. People will say, oh, I'm being super careful. I only go to the store a couple times a week. To me, that's not super careful. Some people might say, oh, we're totally locked down. And then I find out, my teenage daughter's boyfriend comes and goes. Mm-hmm. Well, that's, like you said, it's a leak. It's an opening in your bubble that you've created. So I think everybody needs to, especially when older parents are involved, really lock it down, like really talk to everybody and think about all these opportunities that you're creating. And I bet you can cut back on some of them. You really can. Like, we can do this, right? Kathy, go ahead. I'm sorry.
I was just going to say that, in interviewing potential bubble partners, I think one of the sort of gold standard question is, how many people have you come into contact with over the last week, say? Or over the last month, if people can even remember that far back. And I think that's a clear, at least test question, at least an opening test question, because everyone says, oh, I'm being super careful. No one says I'm being completely reckless.
Right. Nobody will say that, but it's true. I would say that I'm being super careful, but I had to go to the grocery store the other day, and okay, the store's limiting, people in. I'm wearing a mask. I'm staying away from people. At the checkout line, I'm suddenly incredibly close, and then another checkout person comes behind me and says, excuse me, and then a bad guy comes, and suddenly I've got 4 people within 2 feet of me. And at this point, I'm like, okay, I've just been exposed to 4 people. And I am wearing a mask, and I feel better about it, and I really limited my time, and I hustled out of there, but I'm not as confident that my bubble hasn't been, the sort of barrier I've created myself, it has been broken. And so I'm going to give myself, if I had an older person in my life, if that had happened, I probably would say, I really probably can't see you for 14 days. Yes. This is too much exposure for me. I was very uncomfortable with it. And I'm never going to do it again.
I wouldn't either.
It was tough. And it's hard. You don't want to be rude. The guy packing my groceries, I'm happy that he has work and I'm happy he's there, but I don't want him touching my groceries. I don't want him packing my groceries. But at this point, it was just such a complete disaster. I just said, okay.
Whatever, okay. Get in and get out.
Yeah, get in, get out, get in, get out. I mostly have groceries delivered, but not everybody can do that. And we have to recognize that not everybody can do that. Kathy is a 67-year-old grandmother from California. I want to drive to Portland and see my 18-month-old grandson. How can I keep myself and my family safe? So I think the goal here should be, how can we make this happen? Because you need to see your grandchild. Yeah. 18 months old might be a little bit easier to control than older kids too. So what do you think?
Well, I mean, I think that's a young baby. Again, I would just ask the same questions, like how stringent is your children's bubble? Have they been really locked down? Have they gotten groceries delivered? How many people have they had any kind of contact with for longer than 10 minutes in the last week? And if their bubble is leaky, then I would say for the grandmother, I mean, certainly drive and go. Have everyone wear a mask, admire the baby from a distance.
Yeah.
Enjoy, being kind of together, maybe even enjoy a meal together where everyone brings their own food and doesn't touch utensils. But depending on how leaky the one of the bubbles is, whether it's the grandparent or the grandchild, it just goes into your threat matrix in your own head.
I think, in my household, I actually only have my college daughter here, but I try to be the person, because I really trust myself to mask, to wash my hands. So if an errand needs to be run, I do it, because I just trust myself more. I do think, what do you think of this idea that maybe only one person in the household should be the one taking on these duties, because you do have to leave the house? And I'm not talking about taking a walk or walking the dog or getting fresh air. I'm talking about, I have to go pick up a prescription. What do you think about designating one person to be that, just to kind of tighten around, tighten the opening? What do you think?
I do think that is probably a good strategy, especially if you have one trustworthy or most trustworthy person, vigilant. Maybe I should say vigilant rather than trustworthy person within a bubble. And I'm with you. If I had to go get something, I would rather do it myself than have my husband go. Although he claims he's vigilant, he's mostly vigilant. But again, you're still in a household, so everyone in the household's collective risk is still the lowest common denominator.
Right.
So I think it's important to kind of know that unless you're somehow able to hermetically seal yourself off from everyone else in your house and you have your own bathroom and your own kitchen, which seems to be very unusual, anything that anyone does raises the collective exposure of everyone that you're living with.
Right, and your goal should be to try to minimize those. We have some questions about activities. Betty asks, is it safe to swim in a chlorinated pool? I am 77. I have thoughts on this. I wonder what your thoughts are. We don't have enough information. Is it a home pool? Is it a public pool? Is it a pool in an indoor space at a gym? Is it a community pool where nobody's there when you're swimming? I mean, there's a lot of things, because the biggest risk of water is people, right? Being around a lot of people around water is a big risk. Yes. What do you think about swimming in a chlorinated pool?
I mean, I think I would ask all your questions. And just to take like one quick step back, I'm sure we're going to get a lot of questions of, can I do X or Y? And just to sort of level set everyone so that you can start to make your own decisions as well. When someone asks me this, I put it into my head calculator. My head calculator looks at kind of two dimensions, which is one is what is the intensity of potential exposure? So how many viral particles could potentially be shooting out from whatever the thing is per minute? And how long will I be exposed to that? So if it helps you kind of think about this in relative terms. There's some very good articles that have been put out that describe this in simple ways. If you just pretend, for instance, that you need exposure to say 1,000 COVID viral particles to get infected. And there's just some little cheats here that I found. So, I mean, a cough or sneeze can eject 200 million particles. So that's why you definitely don't want to be anywhere close to someone coughing or sneezing and taking it directly in the face. That would be bad. Breathing is 20 particles per minute. So you'd have to sort of sit next to someone for an hour while they were breathing if they were infected. And speaking, especially if someone's loud, can be up to 200 particles per minute. So that could be 5 minutes of talking to somebody. So just that gives you some kind of like relative things to think about. And in a pool, I mean, again, it really depends. I think the chlorine in the water should kill the virus, assuming you sneezed in the water.
Right.
I think that would do it. But you raised a lot of important other considerations. Is this like an indoor pool where everyone's hanging out on deck chairs? How many other people are in the pool next to you? Is it just your own pool? If it's your own pool, then I'm sure you could swim. Your other family members could swim. I think that would be fine. But again, if it's an indoor pool with a lot of people in it, I'd say probably not. That would be beyond my safety threshold. Like I wouldn't do that.
Yeah, I've had people ask me about community pools, and I think about everything that goes on at community pools. You've got tables and chairs, you've got snack bars, you've got children running around. It's a lovely situation, but those are many, many opportunities, and it's too much time and too much exposure for me. But if nobody's at the pool, if it's pretty much empty and you're, sitting on the grass and you're, there's still some level of risk with everything we do, but the water is not the issue, right? It's really not. In the water, swimming in the water, you don't have a risk really. It's everything that's happening around you. Another question from Fran. Oh, this is a tough one. It's actually not tough for me, but I feel sorry for people because everybody wants to get their hair cut. Can I get my hair cut if the salon worker wears a mask and gloves? Should we be outside? So this is where we have to just make choices. What do you? I think I'm going to know what you're going to say, and I know what I would say. What do you think about haircuts?
Haircuts are hard. So, I mean, and I say that with a big sigh because you can't not be 6 feet apart. I mean, you can't be 6 feet apart from each other during a haircut.
Right.
And it depends what you're getting. If you're getting a super quick trim or you're getting, a full color done, those take a lot of time. And sometimes even getting your hair washed where your head's all tipped back and a person is kind of breathing on top of you. Those are all things that would give me pause. If you're both wearing masks and you're outside, if you can somehow get that arrangement going, I think that would be okay. Again, for a really quick haircut. I've certainly read a lot of outrage and indignation that some hair salons have been asking their customers just to come in with wet hair and then not doing blow dries. I think the blow dryer also makes everything, it scrambles my calculator in my head because then you're just blowing stuff all over the salon and, it's possible you could still breathe that in. Haircuts for me are still one of those things that, at least from my own perspective, are not life essential. I would certainly wait until epidemics are more under control. If I was the boss of everything, that is something I would open in phase 3. But I get that people really want this. So if you have to, I would say both of you should be wearing masks. I know that's hard when they're starting to trim hair around your ears. You should sort of like make that work the best that you can. I would, again, get in and get out as quickly as possible. That means you might come in with your hair wet already. That means you skip your blowout. I know that's the best part about a haircut, but these are not normal times anymore.
Right.
And just do what you can and do it quickly and get out.
So I had my daughter cut my hair, and I said, just take off a couple inches. And she went, oops. And I said, oops, it's not what you want to hear. And she goes, I took off about 6 inches. And I said, okay, it's just going to be a shorter haircut. It's just hair. So I think she did a pretty good job. So that's nice. It's kind of a fun way to get close to your family members. You can try your home haircut, but I agree. I wouldn't let somebody wash my hair. I'd go, if I did this, I would go with wet hair. Both people wear masks. I would personally ask my hairdresser not to chat because, you know,
No talking, no talking. That's absolutely.
Don't talk to me, you know, in and out, and I don't need you expelling more viral particles. And yeah, wet hair, no blow dry, and no long hair processing. Like the color, for those of us that are going a little gray, we just have to embrace the gray because it's a pandemic. Somebody, reader named Dallas asks, or maybe she's from Dallas, I operate a Pilates studio, no, in New York City. I operate a Pilates studio in New York City. When I reopen, should my clients wear a mask or gloves? I love the glove question. What do you think?
Pilates, which I've never done, I think is mat-based, right? You don't need weights or anything. So if you can ventilate your studio, I would advise you to open your windows wide. Don't know how big your studio is, so I would, again, have classes, if you must, that are very, very spaced out, where you might decrease the number of participants to just a quarter of what it was before. But again, I would do it really cautiously, and I would wait till probably a phase 3 situation where the epidemic is well under control.
Go find an outdoor space where you can do Pilates, right?
Outdoors even better. Outdoors would be great, or Zoom. I work out with my trainer on video. It's awkward, it's not as great, but you know, you can still get it done. My concern, again, going back to my risk calculator, is people are breathing harder than you would if you were just sitting around. At least you're kind of stationary. I think you're just on your mat or on your reformer machines, which you should be sanitizing.
Right.
But yes, everyone should be wearing masks the entire time during that class and keeping them on.
And how about gloves? Gloves. I don't think gloves.
I don't.
Get the gloves.
My favorite thing is seeing people coming out of the grocery store with no mask and gloves. I just want to remind all of you.
And I mean, I understand gloves.
I mean, gloves, just wanted to remind everyone, this is a respiratory virus. So you want to be blocking access to your eyes and your nose and your mouth. So not wearing a mask and only wearing gloves, like that's not really helpful. I would only wear gloves if you couldn't wash your hands very frequently and you needed to do something. So you can just take your gloves off and put a fresh pair on. I don't see myself how it would be helpful in a Pilates situation to be wearing gloves.
Right, I agree. The only thing gloves might keep you from touching your face, maybe. I don't know.
I guess so. We got your mask on too.
Real quick, listeners are asking for. Sorry.
Oh, I said, but you're also wearing your mask, so you shouldn't be touching your face anyway.
Right, so you shouldn't be touching your face. Okay, we have a lot of questions, so I think we should try to start moving a little more quickly. But real quick, listeners are asking for you to explain when you talk about phase 1 or phase 3. Can you give us just a quick note on what that means when you say I would save that for phase 3 versus phase 1?
So this was just, this started with the federal guidance. Every state seems to be having different phases. Massachusetts, we have 4. So what differentiates phase 1 from phase 2 from phase 3 is varying from place to place. But basically, we're kind of in phase 1 right now, where we have an epidemic that's not really well controlled. The best places, at least in, say, New York, where you're sort of on the downward slope of this, but I don't think anyone would claim they've got epidemic control yet. Phase 2 is when you have infections declining for at least 14 days, you have deaths declining. You're kind of on the back end of the epidemic. And phase 3 would be when you have testing levels that are very high, that are confirming continued sort of sustained low community transmission, where there's been no spikes. So you want to start doing the highest risk activities when the overall background prevalence of the disease is low. Because if you do it when it's higher, it's just going to, it risks sparking something that's much bigger.
So the risk of a haircut's higher in phase 1 than in phase 3.
Exactly.
All right, let's see how many of these questions we can get to. Melanie from Minneapolis says, our cases are still on the rise, yet our state is opening up. Do you think we will experience a second wave in summer or fall?
Yes.
I know. Sad question, yes. What's that going to be, though? A second wave is not going to be quite like it is now. We know more. Mm-hmm. We're better at treating patients. We understand what it is like to quarantine, so we're going to be better at it. And will it last as long? What do we know? We don't really know, do we?
I don't think anyone knows, and it depends what starts the second wave. I'm personally really concerned that the second wave will probably be started by the opening of schools in the fall. That's what starts influenza. People think, oh, like the flu goes with the weather, and no, it doesn't. It follows the school calendar. And I think that's what's going to happen. And it could be even more severe than the first one. And we are better at quarantining, we are better at social distancing, but I don't think we have the luxury, and it would be political suicide in some ways, to shut the economy down a second time. I don't think that's going to happen. So a second wave certainly could be much more severe than this first one. That's in a doomsday scenario. No one really knows. Maybe it'll be okay.
Well, my hopeful take on this is that we've learned we're wearing masks this time. We weren't wearing masks the first time.
Mm-hmm.
We've all been much more careful and cautious, and we're not gathering in groups, and we're smarter. And so hopefully if everybody will just rally, we can deal with the second wave. It's really going to be about how people react to it and how careful they are.
Mm-hmm.
Carrie asked, how do you feel about youth baseball reopening? My son is a catcher and batter nearby and touching every ball that is thrown.
Well, I don't know if you can wear a mask behind your catcher's mask. The touching part, while not ideal, can be mitigated again if you just don't touch your face.
Right.
So, and that's really, that level of discipline is very hard to maintain, especially if you're a child, I think. So
I think we have to reimagine youth sports. This basketball coach was talking about, you can't really play a basketball game, but you can space yourself and you can dribble and you can shoot. And there are things we can do with kids, and kids can learn, but it would be better if they were wearing masks while they were learning, right?
Yeah, and different behavioral change things work for children versus adults. There's been studies that have shown that children are actually more likely to keep masks on if you tell them that they need to do that to help other people, rather than to keep it from keeping themselves sick. So there's different messaging that parents can be doing. And it's really, really important that children over the age of 2 wear masks, because a lot of them are probably asymptomatic carriers.
And children will experience a pandemic in their lifetime besides this one. It's in their future, right?
Unfortunately, yes, with globalization and just more traffic, more wet markets, more international travel, all of that, definitely.
So let's teach them now. We can teach them in a way that will help them and protect them in the future. John asked, is it safe to stay at hotels? What precautions should we take?
I do think staying in a hotel would be okay later. I'm a little bit more cautious and extreme. So, I mean, when I got into a hotel, I would probably Lysol everything in the bathroom and all like the surfaces and the doorknobs. But I kind of do that anyway when I check into hotels. I think it's probably okay. Again, as long as you are taking precautions and washing your hands frequently and realizing it's not exactly your house.
I would super clean. I would actually prefer a hotel that opened to the outdoors, but those aren't going to be your high-end hotels. But
you can bring your UV lamp with you. Consider doing that.
That's a whole other. All right. Catherine asked, let's try. I feel terrible. We have so many questions, and this is such a great topic. We'll do this again, everybody. There's lots more to say, so we'll have another talk. Catherine asked, what can healthcare providers do to help their communities? There's been a great reluctancy to see a doctor because of the fear that the sickest of the sick are going to the doctor. So let's just talk generally about your medical care. Going to the doctor for screenings, for things. At what point there is a cost to not seeing a doctor. If you don't, we're assuming these are people who don't have COVID, but they need medical care for other things. So talk about that real quick.
I mean, I think the health system has gotten a lot smarter also about protecting people from COVID. I think, again, it comes down to your individual risk tolerance, but, if you think you're having a heart attack or something really important, you should go. And there's like room in the ER, at least here in Boston. There's been a lot of messages saying, like, if you want to come in, they have space for you. But as we go out longer, start thinking 6 months or 8 months or a year from now, you're going to have to just start resuming normal care, your normal preventive care, and just doing that, carefully, where you're all wearing masks. Certainly providers are doing their best to limit people in waiting rooms or taking temperatures. I mean, this is just the new normal. And there was always a background risk before anyway. When you went to the health system, you just didn't ever think about it.
You didn't think about it. Right. And I think that our providers they're preparing, they're taking a lot of precautions. So if you're unsure, talk to your doctor and they'll tell you what they're doing. They're doing a lot. And I think that you'll feel pretty safe and pretty cared for. Okay. Oh, so many questions. If we are outside and 6 feet apart, is it okay to take our mask off?
No.
I knew you'd say that. I don't fully agree, but I want to talk about it.
I mean, still no. I mean, there's wind, and you're talking, and if any one of you is sick, you are ejecting particles at 10x the level of just baseline breathing. And people walk by you. I mean, you're just outside. And so, I mean, I think the 6-foot distance helps, certainly better than if you were 3 feet apart, but I would personally keep my mask on.
I think if you're I think there's a lot of variables. Again, if you're in a large open space and people aren't coming close to you and you really do have a social distance, and it also depends on the size of your group. It's a lot easier to keep social distance with 4 people in your group. If you've got 8 people in your group, your brain just can't process 6 feet all around you. It's not going to happen. So your mask needs to stay on. I would say if you're, out with somebody from your household and you're having a picnic with everybody in your household and you're completely separate from people, nobody's around, you're in a quiet, I don't think you would need to have a mask on if there's nobody around. Would you agree with that if you're with your household?
I guess so. But again, I don't know. I mean, I know you live in Manhattan. Here in Back Bay in Boston, it's impossible to maintain a complete 6-foot radius at all times. It's just too crowded here in the common areas, the parks, the river, at least where in my neighborhoods. Also, there's just the act of removing and putting the mask on all the time. I mean, you have a contamination risk every time you do that. So just to me, it just seems easier just to leave the mask on the whole time.
I agree. I was out this weekend. I was riding a bike. I was in the park and I left my mask on the whole time. And it wasn't my favorite thing, but it is what it is. Okay, let's talk quickly. We've got a couple questions about schools and childcare and camp. So really tough questions. So I'm going to ask 2 of them. Stu asked, what are the most important safety components of the new normal for schools and childcare? And Barbara says, should we send our kids to summer camp? What guidelines should we look for? And what happens when they come back from camp? These are very hard questions that people are dealing with. What do you think?
I'll take schools first, which I think is easier than camp.
Yeah.
At least we can start to look to some of the examples of Denmark and Switzerland that have started to at least reopen schools again. I'm not sure all of these things that they do there are going to be possible here, but again, if we're talking gold standard things that you'd want to be doing, you'd want to make sure that classrooms themselves were well ventilated, that groups of children didn't mix, which is kind of unfortunate that a class stays a class with the same teacher every day. I know in Switzerland, they have very precise drop-offs, and because it's Switzerland, you have like a 5-minute window to drop your child off, and maybe here that's not going to work as well, but trying to keep congestion low during the drop-off periods. So and a lot of hand washing, a lot of sanitization, a lot of mask wearing, those sort of basic things. I think that's kind of the best that you can do. And I just think we're reaching a level now where keeping K-12 schools closed this fall is probably not going to happen. It would be better from a public health standpoint, but that's not the only consideration. I think schools will have to open this fall. Camps, again, it sort of depends what camp. Is it like an outdoor camp? If it's like sleepaway camp, I mean, all of these different things.
Let's think about an outdoor camp with 20, 30 kids in the group. I mean, it's a camp, but it's going to be outdoors, not indoors. You still got kids running around playing together. So what do you think?
If you could keep masks on all the time again, a lot of vigilant hand washing, a lot would have to do with like how the camp is run. Masks still have to come off for lunchtime, whether they take a hand washing break every half hour. I mean, these are all things that you would have to think about and know that that's definitely like a bubble piercer.
So if you have a vulnerable person in your circle, you got to think about that, right?
Exactly. And I would think twice if you were living in a multi-generational home to let your child go out to camp.
Right. But if grandparents are across the country, if it's you and your partner and a couple kids and, everybody's young and healthy and you might decide to make that choice.
Yeah.
I guess really nobody can make it for you. You have to decide and we can't really judge either way, but hopefully you'll find kids are really good about learning hand washing and things like that. They will learn. They do learn. Mm-hmm. We've got a question here, another tough question I've been thinking a lot about. Many people are asking about dental care. Dentists seem like a higher risk. I do worry about the dentist, but many people want to know when they could do a dentist visit. Like, when can we get our teeth cleaned again? If I have a toothache, is it safe to go to the dentist? This is tough. I mean, this is real needed medical care.
Yeah. I would say if you have, you know, like pain or an abscess or like a broken crown or something that's really important, like you should just go. The kind of good thing about dentists are they've always been quite vigilant about this anyway. But it's unavoidable from their perspective that cleaning just makes aerosols. So it's actually kind of a bigger risk for your dentist actually than it is for you to be there. Assuming that you as the patient are not there in that sort of 2-week window when your dentist might be infected. So it's kind of like rolling the dice there. But eventually, I mean, everyone needs dental care. That's really important.
I'm going to guess that the dentists are going to do a lot to protect themselves, and that will also protect you from their germs, right?
Exactly. And the dentists themselves have a very strong incentive to be like hyper vigilant about this. So, you know, you could certainly expect to see N95 masks and face shields and all of those things when they're treating you, and just know that the risk is probably greater for them than it is for you. And certainly I've received a lot of emails from my own dental practice that's been describing what it is that they're doing as they get ready to reopen.
I think that's the key. I think your doctors and your dentists are going to be communicating with you and your schools and your daycares and your camps. And you know, hopefully we've given you some tools today to make those decisions. You know, let's kind of, what you said at the beginning, you know, the calculator, it's time, it's amount of exposure. I mean, do you want to kind of give people some just general guidance for going forward, what to think about?
Again, it's got to think about yourself first. Like what would happen if you got sick? Like you have to evaluate your own risks for yourself. You know, the risk factors, it's not just age, it's, you know, whether you're overweight, whether you have diabetes, whether you have hypertension. Luckily, asthma doesn't seem to be a confounding factor, but I think just from a common sense perspective, if you have any sort of breathing issue, you might want to be careful as well. And then it's expanding that onion one layer forward, like who do I live with? Who else might be at risk? And third is this community layer of people. These people 3 Kevin Bacon separations forward who you may not be seeing, and who I would be thinking about if I was running through parks without masks on. That's why I wear my mask also. But again, the calculator, at least for me, is the intensity of the exposure and how long you're going to be there. So if you don't know, get in and get out as quickly as possible. Minimize anything that you don't essentially have to do, and try to make social interactions, you know, as safe as possible, which means wearing masks to the degree that you can. Lots of hand washing. Communal picnics are probably a thing of the past, but if everyone just brought their own little picnic, I mean, I think you could safely do things like that. And try to take as much advantage of the outdoors as you can while social distancing, because, you know, in the fall and winter, at least on the East Coast, we're going to have to hunker down again. Being outdoors is not going to be possible.
Yeah, so definitely enjoy the summer. So let's wrap up with one question. What gives you hope? What makes you hopeful about the future? Dig deep. I have some things that, I mean, I know that we have a tough road ahead. There's no question. I get hope by seeing all the people around me wearing masks. Mm-hmm. I get hope from all the things the emergency room doctors have learned and how much better they are at treating patients. Mm-hmm. They're getting much, much better at it. Mm-hmm. What about you? What do you think?
Yeah. My husband and I now nightly before we go to bed try to reflect on the things that we're grateful for also. I think it's when you're in a COVID hole, it's just easy to only think about that. I share your optimism that it makes me really happy when I see people wearing masks and seeing like what a huge uptake it was from, say, mid-February, right. And I'm the only crazy one outside wearing them. I have hope in technology. I'm a scientist at heart. I do think we'll find a vaccine. I don't know that it's going to happen in January, like Project Super Speed or whatever right. It's called. But I do think that there's cures out there. And I also take hope in how this situation, as awful as it is making people intentional about how you spend time with people, how you still have to find different ways to maintain those connections, and just how badly we miss them and things that we took for granted. So if you turn a negative into a positive and just be grateful for the people that you have in your life and be grateful for your health every day.
And I want to tell everybody listening a couple things. We didn't get to everybody's questions, but I'm going to take a look at all of your questions and we will answer them in the paper. We will have another event. Shan, you'll join us again, I hope, at some point. And I want you to know that Times is here for you. We are doing a lot of coverage on how to cope how to move forward, and we are going to be there every day. You can read the Well newsletter. You can just, all of our coronavirus coverage is free and continues to be free. So we're here with you. We're going to help you along the way. Thank you so much for joining us today, everybody. And our thanks especially to Shan for answering questions. Thank you for being here. And thank you for being the voice out there that got everybody on board with taking better care of ourselves by wearing a mask. So we're very grateful to you for that.
Well, thank you for having me. And thank you, Tara, for all the amazing work that you've done. And my shouting would not have gone that far if you hadn't picked it up. So you amplified it.
Good. So this event is a weekly series that takes place Mondays at 1 p.m. Eastern. Next week is Memorial Day, so we're going to take a little break. But we hope you'll join us on June 1st to talk to pediatrician Dr. Perry Class. We know you have a lot of questions about children and health. Dr. Class writes for the Times regularly. She's fantastic, and she is here for you. So to find out more about our full slate of digital events, please visit timesevents.nytimes.com. There's so much fun stuff there. I hope you guys will check it out. There's information like this session. There's an evening of calm. There's a lot of cool stuff. So go to timesevents.nytimes.com. And finally, we want to give a special thank you to all of our subscribers. You make our work possible. Thank you. We look forward to speaking with all of you again. Stay safe. See you guys.
Bye.